Hello, everyone, and this is going to be another episode of the Happy Doc podcast. Our next guest is going to be Dr. Phil Boucher. He is a pediatrician, and he is on social media and discusses a lot about what parents and families should know about the coronavirus. Obviously, this is a very timely subject right now, and we do a pretty comprehensive conversation around the do's, the don'ts, things to consider. We talk about creativity and the ability to be creative during these times, both as family members and himself as a health professional, and using things like telemedicine and all of that. So we get into a pretty holistic conversation, and it was really great to have Dr. Phil Boucher on. He has his own podcast called Parenting Matters. And essentially, if you just go online and search Dr. Phil Boucher, and his last name is spelled with Boucher. The ER is kind of silent there. If you just search Phil Boucher, you're going to find him on lots of social media channels. He's on Twitter as Dr. Phil Boucher. He has a Facebook group, which I'm going to link in the show notes. He's also on Instagram, and his tag is Raising Good Parents. So there's many ways you can find him, and it was a great conversation. So stay safe and stay informed. Please enjoy the episode. Hello, everyone, and welcome to another episode of The Happy Doc. I'm very excited. I'm always excited for my guests to come on to the show. With this episode, it's interesting times, and obviously we'll get into that. But I have Dr. Phil Boucher. He's a pediatrician, and he's also taken on the topic of coronavirus. I see him putting out lots of content in that area as well. So we're going to jump into all that stuff. But Dr. Phil Boucher, thank you so much for being on. Can you introduce yourself?
Yeah, thanks for having me. I'm really excited to be here. I am a pediatrician in private practice in Lincoln, Nebraska, which is like the very center of the country for those flyover country sort of people. I work in a group of about 10 or 11 other pediatricians. We're at one site. This is my hometown. I grew up here in Lincoln, did my residency and stuff nearby, and then came right back to practice in my hometown. So outside of work, I have 5 kids, and the oldest is 10, the youngest is 1. And so, yeah, we've been doing, quite a bit of like craft projects and trying to send them outside. The weather is almost good enough to just send them outside regardless at this point.
Okay.
So we've been trying to keep busy with all this quarantine or social distancing stuff.
Yeah. And we'll definitely get into that. I didn't know you're from Nebraska, right? I think that's, I come from actually the West Coast originally, California, beautiful sunny weather in the Bay Area, amazing spot. But I'm really curious what it's like to live in Nebraska.
Well, it's the best of no worlds because we have no beaches, we have no mountains, it's flat, but the people are just amazing. So, I mean, what it lacks in like things to do outside, it makes up for with great people. Our slogan, our new slogan, which everyone has been talking about lately, is Nebraska ... It's not for everyone. And so it isn't for everyone, but we like to travel too. So we're able, fortunately, to make escapes to those more scenic and temperate places. There are a couple of good weeks in the fall and then a couple of good weeks in the spring where it's like beautiful weather. Otherwise, it's usually quite chilly in the winter and that we get lots of snow. And in the summer, it's 95% humidity, 100 degrees. And so we take advantage of the couple good weeks that we have.
You're not selling this very well.
It's not for everyone. I don't want people to just start showing up, especially right now with coronavirus. I want people to stay away right now. I mean, come back in the fall, maybe for those 2 good weeks, and we'll have you for a football game or something. But otherwise, it's not for everyone.
Yeah. Okay. Interesting. Well, I'm glad you were being realistic, with the,
right.
with your overview of Nebraska. Okay, great. So why pediatrics?
I tell medical students it's because I don't like taking care of adults. And that's how it's always been. Like, as I went through medical school, I just found that taking care of adults did not fill my bucket up, mostly because of all the lifestyle choices that adults tend to make that contribute to the health issues of them and their families. And I like pediatrics because even the sick kids, and I like taking care of well kids and sick kids, they're not responsible for their condition. And so I'm probably just not empathetic enough to take care of adults as well as I should. And I'm grateful that there are so many good adult doctors out there that take such good care of adults and allow me to focus completely on children. And I also really like working with families and seeing kids on a regular basis and seeing not just the kid develop, like that's great, to see them grow, and kids do great regardless of all the different things that we worry about often for them. But seeing the parents grow too, and really like from that first kid where they're so worried and asking all these questions and everything seems very high stakes, to second, third child, et cetera. And just seeing the parents grow as their child grows too, that just like really fills my bucket up. And it's really fun to get to play a small role in the child and family's development. And so that's what I like. I mean, we have 5 kids, so I get plenty of practice at trying to be a better parent at home, and sharing those things with families has just been a good mix of both the medicine, science, pediatric side of things, and also the parenting mindset, those sort of things that I enjoy talking with families about.
Yeah, that's amazing. 5 kids. Wow. Yeah. And something with kids, and I hear this a lot, and you basically said it, was you get to see that ongoing impact. And
right.
With children, I would say, at least in my short time of experience, I feel like you can really hit them at pivotal points before they go down a certain direction.
For sure.
And the education aspect of certain things, getting to teach them maybe certain topics that they're not even comfortable to discuss with their, family or friends, and actually giving them the truth about what to expect with certain changes in life. And obviously that, but I do think that for a lot of people such as yourself, it really is gratifying.
Oh, it's so they, like you said, are in those formidable years where if we can see things coming, or if we can address issues, then we're talking about a lifetime of betterment, and not just like medical stuff. I mean, the medical stuff, screening for inborn errors of metabolism and everything like that, like those things are pretty automated now, but adverse childhood experiences, or the teenager that we're just doing a sports physical for, but we uncovered depression or anxiety or all those different things. I mean, there's so many examples of those that it just seems like, well, all you're doing is a sports physical. Like we could do this at CVS or at their high school. Well, those things, if we're able to do that and build that relationship with those families and with that child, then they'll open up to us. And those are things that if we can catch and intervene at, we can have a huge lifelong impact. And I mean, I probably overstate my importance sometimes, but I do think that those things matter for a lot of families, and for some they don't matter, but for some, those things are pivotal and make the difference in a lifetime of issues.
Yeah, absolutely. I mean, I'm sure we could dig into this topic for a little bit. You also mentioned the ACEs study, which is a whole other can of worms. And I know a lot of people aren't familiar with it. We won't get into that in this episode, but I do think it's a fantastic topic. Let's get into, you mentioned obviously pediatrics. You mentioned obviously you have a larger family. Coronavirus is out. And,
right.
We looked at this in maybe December. November, December, a lot of people were downplaying kind of the impact. Now we're in mid-March, right? And moving ahead. And now it's in all the states of the United States. We're getting more spread. You've taken on the social media aspect of really starting to speak about this. And obviously I saw a few of your videos as well. But how are you wrapping your mind around, this topic, and what are you teaching the public?
I think for me, I mean, there's so much news and information out there that it's really hard to even just keep up and have up to date information on what's going on. But what I've tried to do through videos on YouTube and my podcast is help to get families good information. And as a pediatrician and parent and whatnot, I feel like I can help touch families to say, okay, here's what you should be doing. Here's what you should not be doing. Here's what you should worry about. And here's a bunch of things that you don't need to worry about. Because I just see that kind of coronavirus anxiety in my patients, in my online community and presence online that there's so much information out there that it is really hard not to get really worked up about it and not know who to turn to, what is reliable information, and to have that calming presence. So that's really what I've tried to do with my YouTube series and podcasts and everything like that, is really just to try and calm fear, calm anxiety by giving information, and giving information that like is less timely, meaning that I can do a YouTube video. One of my recent ones was on what to do if my child has a fever. That works for coronavirus. That works just for normal, everyday stuff of what to do. And here's why you don't need to freak out and run to the emergency department because your child has a 102 temp. Instead, here's some practical strategies. Here's other things to look for so that we can move through this together and not over anxiety, over pressure our family, over, make our child seem so precious and fragile that we have to run, or we have to, get in a fight at the supermarket over a bottle of ibuprofen or a roll of toilet paper or something like that, just to try and calm anxiety and calm fear amongst parents. And I feel like I'm in a good position for that because I get to talk with so many parents that I can hear and just ask them on a regular basis, like, what are you worried about right now? And then I can try and craft content around what people are telling me online on my Instagram or Facebook group and whatnot, what they're experiencing, so that we can craft messages that help.
Yeah. No, I mean, and I think that's really powerful, right? I mean, the Spanish flu was, 100 years ago, right? We don't have we have some examples like Ebola and whatnot, but, this is a little bit different. I feel like the sense of that anxiety, that fear. I still don't really get the toilet paper thing. I don't
understand that either,
but that's for another time. I've seen so many memes about the toilet paper stuff.
Oh my gosh.
But yeah, you mentioned a little bit earlier, thinking about, what you do with, your discussion around this topic is the do's and the don'ts. So let's get like very tangible here for a second.
Yeah.
What are some clear do's? What are some clear don'ts? What are some maybe considerations, those types of things?
Right. So in general terms, in terms of worrying, I think I would try not to worry excessively about it, because if we're doing what we can, just like most of the things I talk about, if you're doing what you can to be preventative and protective, then you're doing everything that you can. And continuing to worry or check the news every 5 minutes or have the news on while you could be just playing with your kids or just having quiet, free time, that sort of thing, it just drives up anxiety and fear without doing anything tangible that actually, changes outcomes or helps. Things that you can do is social distancing. I mean, limiting your potential to either catch the disease or spread it by staying in your own little bubble of your family life. I realized inadvertently, we weren't really trying. My wife's really good at social distancing from the outside public. I mean, they go on walks every day. They're home, all 5 kids are at home. So they're going on walks every day. They're doing plenty of outdoor stuff. But I realized that I hadn't even put the car seats back in the van from this weekend when I had to get them out to move something. And it was Wednesday. And usually, we would have been in the van and the car seats a million times, and we just haven't. So just saying, okay, do we need to do this, or can we take a break from doing this activity, this interest, this play group, this play date, this thing that we're going to do so that we can protect ourselves? And do we really need to expose ourselves in the community to the potential for sharing coronavirus when otherwise we could just kind of hang at home? We can, be innovative about getting groceries, send one person to the grocery store in the evening or in the early morning to get groceries so the whole family's not going or not getting exposed. Or can we do Instacart or something like that where we don't have to go to the grocery store? Can we still, teleconference with family or friends, or have a play date over FaceTime where the kids just kind of can check in and chat with each other? Can we write letters? Can we do those sorts of things where we're not exposing each other to all of the coronavirus or other germs that are about in the community? And what you spoke to too is in 1918 with the Spanish flu, there wasn't social media, there wasn't Facebook, there wasn't Twitter. I mean, there was none of that. So even though it was terrible and devastating, like, people weren't worried constantly about it because they just didn't know about it until it came to their community and spread through. And then we're just way ahead. And now we're at the point where everyone is just kind of sitting, watching Netflix, reading the news, and ratcheting it up the fear and anxiety. So If I talk with parents and they're telling me that they're worried, I say, don't read the news for the next 24 hours. Like, nothing is going to change in 24 hours that's going to impact something that you need to do specifically. If you're washing hands, if you're doing social distancing, you've done everything you can. The news will not change. We'll still all be here in 24 hours and we'll still be going through this, and you'll have 24 hours of peace, quiet, break time.
Yeah. Yeah. I mean, those are some great tips. Clearly, as you mentioned, right, the social distancing, being creative with the use of your time. Obviously, I mean, it goes without saying, hand washing and those types of things, disinfecting areas. What are some clear, I mean, you mentioned some of them, right? But like, have you seen anything online? And I'm just almost like brainstorming with you on this question, but have you seen anything online where you're like, ooh, that is not what you need to be doing? Have you seen any kind of false statements, anything that's kind of, as a pediatrician, obviously as a physician, are like, ooh, we shouldn't be looking at it this way?
Yeah, I mean, I think that I've unfortunately seen some things that just make me feel like, gosh, what are the real priorities? One example is like, well, we're supposed to limit till 10 or more, but we're still going to have soccer practice or football practice or something like that because these kids need their reps for little league soccer or, flag football, and things like that are just kind of disappointing in my opinion, that we're still like trying to enforce that, or this is so important that we cannot miss a baseball practice. Like, this matters so much, guys, that even though everyone else is saying social distance and avoid contact, like, we have to play baseball. We have to continue practicing baseball. Things like that are really disappointing to me because it shows, unfortunately, people's true colors often, or their true priorities in the face of this pandemic. And it also shows their kids that this is something that is more important than the health and safety of our community. Is you got to play baseball, you got to, meet and exchange homework and those sorts of things. Like, right. There's things that can clearly wait. There's plenty of, people have talked a lot about all the different kind of woo treatments for coronavirus. There's a laundry list of things that don't work for coronavirus that are being hawked by many who have the opportunity to make a profit.
Right. Well, essentially nothing works for coronavirus. I mean, at the end of the day, it's supportive care. It's the very simple things to help treat the fever, to maybe help soothe the sore throat, the cough, what have you. But there is no cure.
Yeah. And so that's the thing, is like, that's what I've tried to talk to parents about too, is like, you don't have to go buy special things. You don't have to make special Amazon purchases for things that are hawked to be supportive for coronavirus or cure for coronavirus. It's the exact same stuff that we do every day for every other viral cough and cold. And then it's watching and monitoring. So making sure that we're not getting, more difficulty breathing or dehydration or those sorts of things. At the end of the day, there's nothing in particular that makes coronavirus special or particularly virulent. It's just that it's novel. We just don't have the natural immunity to it.
Yeah. Yeah. Let's hop into, focusing on kids and how that impacts coronavirus for a second. Right. So when I'm just thinking about this, right, in general, and I don't know if you know this, has there been any deaths in the child population specifically for corona? I don't know the number. I don't know if that's true or not. I don't think there has been, or it's very low.
In the U.S., for sure, there haven't been any. Around the world, I'm mad. I think I've read some reports out of China that there were a few, but a very small minority of patients and very, very small minority of children who got coronavirus that had severe disease. And most of them had underlying things, just like adults with the disease. Most of them had underlying issues that contributed to the severity of their illness. So in general, it seems to be nearly entirely sparing children from severe disease or even from hospitalization. So, I think that is helpful for families to hear, is even though we're kind of worried and everything like that it's not going to likely have any scathing impact on our children or our children's population. I think that almost lulls parents into complacency in some ways that I've seen, because they feel like, well, they're just going to get a cold. It's not going to be a big deal.
Right.
And that's true. But it then exposes the vulnerable populations to disease when you're like, well, my kids, they can still go to the mall and we can all go to the grocery store or do a play date or see relatives because they're just kids. They'll just get through it. Well, but there's plenty of other people that are much more vulnerable, and those will make up the more severe diseases and the mortality rate will be attributed to them when kids are certainly a vector for spread.
And that's what I was going to talk to you about, right? So with children, your concern, or the concern in general, is not, severe illness. The concern is the spread hotspot.
Right.
And obviously, kids are faster. They're very social. They're not as clean, they're not using,
they're not as clean. That's for sure. And they just get right up in your face because they have no, social distancing, regardless of if they're social distancing. They just don't respect personal bubbles either.
Right. Exactly. So I'm, you can imagine, obviously I'm stereotyping. I'm thinking of one child right now, but you can imagine an ADD boy running around,
sure.
and touching everything and getting into people's faces. And now all of a sudden, hey, this kid looks fine. Oh, they're not sick. They don't have a fever. They don't have a cough, but yet they're touching everything. And then any public area, is, possibly susceptible to some random child who is just running around. So I think that's, obviously I'm sure you're advising parents to keep a really good eye on the children, have them follow all of those, do's that we kind of discussed earlier. Has there been any specific tips you're giving to parents with kids of certain age groups or anything like that?
I think in general, just giving everyone a bubble and trying to keep them in the bubble as much as possible, because you're totally right. It's very hard to control a 3-year-old who's touching everything and running around the grocery store or around grandma's house because they're visiting or something like that. There's just no way to prevent that spread. And so the best thing to do is just take it out of the equation by saying, well, we're just going to FaceTime grandma this week and we'll go visit her in a couple of weeks when things have calmed down. That's the best approach, especially for those kids like you illustrated. And that's a great example. Is just the kids just run around and touch everything and lick everything. And lick everything. And it's impossible to just, don't touch that. Don't touch that. Don't touch that. You wouldn't even, there would be no reason to go visit grandma if all you're going to do is tell them, don't touch that over and over again. It would be better to just do a FaceTime visit. And then the kid can wander off when they get bored and avoid all of that altogether.
Yeah. So you're really in the front lines, pediatrics is in the front lines for the children, right. Family medicine more for adults, but also children, emergency medicine, of course, OB, of course, a lot of these fields are seeing people for the first time, getting those first interactions. Where are we at with testing?
Terrible. We just don't have the tests available. So we can't test. I mean, we have done a few tests in the office. I did one yesterday because they had risks and exposures and everything like that. But in general, we're able to test a fraction of who should be tested. And I think the problem is that we don't want every test to be positive. And if every test that we get is positive, that means we're way under testing. We need to have a negative to see what the true burden on the community is. And we need to get a lot of negative tests to say, okay, here's where it is, and here's where it's not. I'm all about not testing. I hardly run any labs on kids ever. I hardly get x-rays or anything like that. But this is something where we do need to be proactive about testing more so that we can find it before it spreads. So I hope that makes sense. Yeah. That if we're just waiting to test only those that are likely to be positive, then we're missing a lot of cases that are positive that haven't quite shown themselves yet. And we're underestimating the disease burden in any particular community. And so if we could test more, I think that would be worthwhile.
So I think the worst part is not having someone who is sick and is clearly, exposing symptoms. I think the harder situation is having that mostly healthy person that might have a risk factor, might have some exposure. You're not sure. And meanwhile, because they look fine and they don't have a fever, and now obviously, like we talked about before, they're still confident and interacting with people. And then those are the individuals that are really going to be, spreading coronavirus.
Right. It's the asymptomatic spreaders and those that aren't sick, that aren't quarantining themselves or socially distancing themselves because they don't feel sick or they don't feel that sick. That's going to be the people that really spread it through a community. Whereas in Asia and places that have really taken it seriously and clamped down and really made that difference. China had 0 reported cases, domestic cases yesterday, because they've been very aggressive about social distancing and quarantining and keeping people separate. And so if we can adopt those sort of strategies, I think we'll be much better off in the long term. And China has the ability to do that much more so than we can in the US. But just trying to impress upon people how important it is.
Yeah, absolutely. With the fear and anxiety, is it all hype, or is there authentic need to really tamper down our, practices, our work, slow things down? I see a lot of this, especially on Facebook, mostly with, individuals who, don't have much experience in the healthcare field. Do you think it's all hype and we're being overprotective in the situation? Or do you think authentically, how we've really clamped down, reduced travel, reduced, obviously work hours and those things, clearly having an impact on the market? But do you think that right now that slowdown is absolutely necessary?
I think we'll look back on it and say, well, that was a little bit of an overreaction perhaps, but I would rather have that be the case than the opposite. Like, why didn't we take this more seriously a couple of weeks ago when we had the opportunity to intervene? There's still I just saw, a little dot map this morning of the US, and there's still, most of the states are quite small red dots. And so, I think we're at the opportune moment to really clamp things down and hopefully spread it out so that we can flatten the curve and the disease burden is not so great right now. So that we can get resources where they need to be. In our office, we've, taken a huge hit in patient visits and our ongoing financial stability because we've been pushing patients that don't need to come in off so that we aren't bringing them in unnecessarily, which is something that hospitals and private practices and everybody has to consider is like, when do we stop doing elective surgeries? When do we stop having well child visits and giving vaccines and those sorts of things because we want to protect the community at our own financial peril because we're not having that continued revenue stream coming in. We're pushing people back that eventually they do need to be seen, but then everybody's going to need to be seen in a few weeks and months when this calms down and we have to, make up for it somehow. But I think that we're just realizing that this will pass. We'll get through this. It will be a hardship for the medical community in a lot of different ways. It'll be a hardship for the United States and the world in a lot of different ways, but we'll move through this and we'll see the end of this come and hopefully it won't be so severe right now that we can spread it out and continue life as much as we can as normal. So long-winded way of saying, I don't think we're overreacting right now. I hope that in a couple months we say, gosh, we overreacted, but it worked, rather than the opposite.
Yeah. And I think that's really well said. I think at the end of the day, whether it's overreaction or not, let's protect our society. Let's protect our systems. Let's make sure that this stays instead of, obviously, I think you've seen a lot of those posts from Italy, for example. They have a much older population and then their ICUs are flooded and then they're making these decisions of who to save and who not to save. And obviously, you would hate to have any of your family members not chosen for that ventilator, right?
Oh, for sure. Yeah. That's what we're trying to prevent here. And that's what I think we can do everything that we can at this stage to prevent getting there. Will we get there? I have no idea. I hope not, obviously. But the more that we do now, the more we'll just say, phew, we reacted really strongly to this, but it worked. And we're going to rebuild the thing, the market and the practices and hospitals and everything like that. We'll be able to come through this, but it'll be much better than the other side.
Yeah. Yeah. It's just very interesting times. Like it's confusing in a lot of ways. It's strange that this is more, it's not completely true, but it's more selective to harm the elderly population, those with, who are immunocompromised or have, diabetes, heart failure, respiratory issues, all of those things. It's very strange. And I think like, as we're talking about, the biggest thing we can do is just be cognizant, creative, preventative, and just be mindful. And as we're kind of talking about, I think we're both pretty hopeful.
I'm very hopeful
that if we, take the right steps, that we'll be able to slow this down and get through this. is there any question, any thoughts around coronavirus, something that you discussed maybe that I didn't ask?
I think one thing, I liked what you said about being creative, and we've been able to, in our practice, be creative. One, because we're in private practice and it makes it easier to kind of innovate and try new stuff without lots of committees and bureaucratic red tape and whatnot. And so one thing that we've been doing is telemedicine visits. And this is something that I've been kind of slowly working on for the past couple of months, not because of coronavirus at all, way before coronavirus. This is something that I saw, okay, we could have this in place. And it's really helped to have that infrastructure in place so that we can continue to see patients. We can help our community without jeopardizing our staff, without bringing patients in unnecessarily and exposing them to other germs in the office. So that's one place where I think we've really been able to be creative and innovate, and our patients have received it really well.
Yeah. I mean, it makes a lot of sense. So like, I think we had touched base a little bit earlier about this. They just implemented telepsych for us,
right,
and allowing us to do these visits through Zoom. And I'm sure Zoom stock's looking pretty good right now.
Yeah, I bet.
But yeah, so it's just something else we can offer. I mean, the only thing is, obviously, as you know, there is information you're going to glean from the physical exam, from being in the room.
Right.
But if you have to have a visit and it's not high risk, at least right now, why not? Why not do it through Zoom or some other form?
Parents are really embracing that. Like, they jump at the opportunity. Right now, so far, I've used it mostly for medication checks. So ADHD, anxiety, depression, where we're able to, like, really, the physical exam is important to do on a semi-regular basis for those to make sure weight gain and blood pressure. And, there aren't other comorbidities that we're not discovering. But a lot of those visits, it's just talking through how's things going, what are your symptoms like, are your medications okay, things along those lines that we can do over a telemedicine visit, keep the family at home. I mean, yesterday I did three telemedicine visits with teenage boys with ADHD, and all of them are sitting on the couch. Their mom is right next to them, all three shirtless. And I had to ask, because we don't have any adolescent boys in our house. I was like, is this a thing? And they're like, oh my gosh, all the boys, none of them wear shirts. They all just run around the house shirtless all day long. It's ridiculous. But like, that's something that I hadn't appreciated before, was just the comfort level of being able to sit and talk in that home environment where they're more comfortable, and save them the process of coming into the office, waiting in the waiting room, waiting in my exam room, talking, on school days when school was in session, the idea of pulling a kid out of school at 9 a.m. for a in the office visit. You got to go there and pick them up, or take work off in the morning so you can bring them, drive, waiting room, waiting in the office, exam, visit. Well, it's almost lunchtime. We got to stop and get lunch. Like, that's like 3 hours for a 15, 20, 30-minute appointment, which if we could just have the parents pull them out of school, sit in the car, and do a telemedicine med check from the school parking lot, then they can just go back to school right after the visit. Things like that we can be creative about. We can also use telemedicine for evaluating a patient to say, okay, how sick are they? Do they need to come into the office and be evaluated today? Can we see how they're looking at, over the next 24 hours, or do they need to go to the emergency department or something along those lines? So we can look at their work of breathing. We can look at their hydration level, looking at their mucous membranes, their energy and consolability and those sort of things. And at least say, we need to see you today. I'm worried about this, this, and this, or let's check in again tomorrow and see how things are going, versus you need to go to the ER because your child is very ill, or call 911, something like that. We're able to at least lay eyes on them, even if though we can't lay hands or listen to their heart or lungs easily. There's a lot of information that we can glean from that telemedicine visit, and it allows parents to get that reassurance that they need, that, okay, everything's okay. Parents thrive on the reassurance that a professional has looked at my child and says that they're okay. I can be more comfortable. I can tolerate this. I'll do these things to treat their fever and make sure they're comfortable. And then we'll check back in as needed.
100%. And I think you mentioned something in there that I think, we were alluding to this earlier. This time is very different than the Spanish flu, right? Like Spanish flu times, right? 100 years ago, we didn't have this capability to speak digitally, right? You're in Nebraska. You said Lincoln, Nebraska. I'm here in Philadelphia, right?
Right.
We're talking.
Right. I mean, I can see that you're not working hard to breathe right now. You look well hydrated because you're not, listless, lethargic, obtunded or anything like that. You're smiling. You're happy. Like those are all physical exam findings. I could make a 99214 visit out of the physical exam findings that I can see from you right here.
Yeah, exactly. So we have this opportunity now, and I think a potential ramification, we didn't even mean for this to happen with the virus, is I could see how there can be a lot more arguments in the future from physicians, from practices, from EMRs to consider blending the physical with the digital. I think that's something that I'm personally very excited about. I think we have a lot of opportunities with really new technologies to help change some things around, make things more efficient. But I think this kind of forced us as a society to, be really creative. Like we talked about, I saw this Chrome extension for Google Chrome where you can, it's like Netflix party or something. So this is just a fun thing I found out. But if you have family, friends or whatever, you want to do a movie night, you literally can download this extension on Chrome and you guys can all watch the same movie, pause at the same time. And there's a chat box. So you can chat with people while watching the same film.
Necessity is the mother of invention. And I think there's lots of necessities. I mean, our kids have been loving, there's Mo Willems who does these kids book series, Pigeon Needs a Bath, the Elephant and Piggy series. He's been doing a daily doodle with kids where he just sets up his camera like you and I have and is on YouTube and just teaches kids how to draw pictures and like things like that wouldn't have come out if not for this need. And it's been so neat to see all the different ways that people have been innovating and supporting each other through this crisis and pandemic.
Yeah. I mean, I think, we can find the good and the bad. Obviously there's some bad in the good, but in this case, we're trying to be creative and find those ways to, and in some ways I have to say is I've been talking to my family more, right? Like I've been more cognizant of, some people I might need to keep in touch with. So I think in a weird way, whether we want to say it, there's some areas where this has brought us together, has, really emphasized how important family is, being creative, having those times to listen to those stories as a family. Do you feel like that's been kind of true for you guys? And
Oh, for sure. It makes you much more grateful for the way things were a couple of months ago. In that you could just, not have to worry about going out or people along those lines. So hopefully that will hang around, that gratitude for the way things are when everyone's healthy and we're not in pandemic mode, and people will be more empathetic of their fellow man and woman and neighbor and everything like that, because everyone kind of has a glimpse of what it's like to be in this situation. And so hopefully that will spread, or at least it will linger after coronavirus is done.
Yeah. So, I mean, it'll be interesting to see how long this goes for. Neither you nor I has a crystal ball here. I think a lot of this is going to be dependent on how well we do those very simple preventative measures we talked about earlier. How can people find you and reach you?
So I have a couple of different places. I mostly help parents. Sorry, my phone just fell off. I mostly help parents on Facebook and Instagram. So I have Instagram handle at Raising Good Parents and a Facebook page that's just Dr. Phil Boucher. And I have a parenting Facebook group called Present and Productive Parents that has a couple thousand members and is parents helping each other out. And then I'm on Twitter at Dr. Phil Boucher as well. I have kind of an online presence for physicians for time management and helping physicians manage their time better. But then you can find that on Twitter or LinkedIn or wherever as well. So I'm kind of on all the platforms. I'm not on TikTok though. You won't find me on TikTok right now. Who knows what the future holds, but right now I'm not that good on camera dancing.
There's a lot of kids on TikTok though.
That's true. And one day they'll be parents, and maybe that's why I'll be on TikTok in 10 years to reach them there. But yeah.
Amazing. So we'll definitely have those links up for everyone. Obviously, awesome. It just sounds like the easiest way to find you is just at Phil Boucher.
Yep, and at Dr. Phil Boucher.
And Dr. Phil Boucher. So awesome. Well, I think we had like a pretty comprehensive conversation. There's so many things we could talk about.
Oh my gosh, yeah.
And I'm looking forward to have more conversations. That was great.
Likewise. Thanks a lot. This was fun.
All right, guys, that's the episode for today with Dr. Phil Boucher. I want to reiterate the very important points for everyone. Something we discussed in the episode is whether people are overreacting or not. It's so important to still take this seriously. We would much rather overreact, stay safe, and reduce exposure, and then say we overreacted months later. So everyone, social distance, wash hands, stay safe, be smart, and expose people less so that we can ultimately reduce the cause of harm to other people, reduce flooding our hospital system, and keep up with the news, of course, but don't overly panic. Watch and consume media in a way that's going to be actively really promoting your ability to stay safe and do what you need to do. As with always, guys, stay happy, stay fulfilled, keep listening to great content, and I hope that you are feeling a little bit more uplifted from this episode. Thank you, Dr. Phil Boucher, for hopping on, and I'll see you guys on the next episode.